Hello everyone, this is Saman Salim at SS Medics and today we are going to discuss some MCQs about COPD. So which of the following is not associated with COPD? The options are celiac disease, cerebrovascular disease, osteoporosis, depression or bronchiectasis. And the right answer here is option E, that is bronchiectasis. So although it seems like bronchiectasis might be related with COPD, but actually it's not. Bronchiectasis is very strongly associated with cystic fibrosis, but not with COPD. So which of the following is not a risk factor for development of COPD? Low birth weight definitely is, childhood infections, maternal smoking, pets and carpets, and airway hyperreactivity. So the right option here is option D, that is pets and carpets. Next, which of the following is associated with emphysema? So certain viruses are given and you have to choose which one is associated with emphysema. And the very surprising answer here is that the right option here is option E, HIV. So HIV is associated with emphysema and the reference is again from Davidson. Which of the following predisposes to the development of COPD? And the right option here is adenovirus. So having a repetitive and long-term infection with adenovirus predisposes to the development of COPD. So what causes edema in COPD patients? The options are cor pulmonale, and this is the most commonly wrongly chosen answer. People think that cor pulmonale is the reason of edema in COPD patients, but the actually right answer here is hypoxic hypercapnic kidney, or you can say the altered salt water metabolism. That is the main reason of edema in COPD patients. Again, which of the following is associated with COPD? But here the options do not have any viruses in them, but in fact certain symptoms are given like morning headaches, cor pulmonale, clubbing, crackles, and hypertension. So the mind thinks that maybe clubbing would be associated with COPD, but no, it's not. Crackles, they are only present when there is an acute exacerbation because of some infection. Cor pulmonale, if the patient has developed right heart failure, only then. But the most common association with COPD is with morning headaches, and that also tells you about the carbon dioxide retention and that the patient is very sick and you need to admit these patients. These patients might need assisted ventilation. So you should always ask about the morning headaches and edema in the patients of COPD. So which of the following is not a pattern of emphysema? And the answer here is option B, that is circumacinar. Next MCQ is that a 20-year-old girl has presented with dyspnea and cough. Her chest X-ray shows hyperinflated lungs with flat diaphragm. Working diagnosis of COPD is established. And which one of the following is most important? So here what you should take note of that the age group is just 20-year-old, which is not the common age group for COPD. The common age group is above 40 with a 10-year pack history of smoking. So if a very young patient presents with COPD, what you should always consider doing is alpha-1 antiproteinase assays. So here the right option is option E, alpha-1 antiproteinase assays. A COPD patient has presented to your GP clinic. His symptoms are not well controlled on bronchodilators and needs an additional therapy. Which of the following should be added next? So here the concept is to check for the COPD patient not controlled on bronchodilators, which drug will you add to the regime? And the answer here is option C, that is anticholinergic agent. But if the similar question was regarding a patient of asthma, not controlled on bronchodilators, we would have added inhalational steroids. Now, which of the following is not a red flag sign of COPD? Morning headache? Yes, it is. Cyanosis? Yes. Peripheral edema? Yes. Altered conscious state? Yes. Distance traveled in 6 minutes is less than 150 meters? No, it's not. It is a very important sign to see the prognosis, but no, it does not it's not a red flag sign for admission. So here correct option is option E. Thank you so much for watching the video, and please subscribe the channel if you like the content. Please give me your feedback. What type of video would you like? Would you like to have just a video about the questions and not the answers, or would you like to have both the questions and answers in the same video? Please let me know in the comment section. Thank you and have a good day.